Here's part 2, flash review of understanding cardiovascular drugs classes to discuss. In this videos are diuretics, beta blocker, calcium channel blockers. Diuretics are a class of medications that help the body eliminate excess fluid by promoting urine production. Diuretics work by affecting the kidneys, which are responsible for filtering blood and balancing fluid and electrolyte levels. There are three main types of diuretics. 1. Thiazide diuretics. Thiazide diuretics work by inhibiting the sodium chloride transporter in the distal convoluted tubule of the kidney. This reduces the reabsorption of sodium and water, leading to increased urine output. Thiazides are often the first-line treatment for high blood pressure. Side effects: hypokalemia, hypercalcemia, increased blood sugar, and dehydration. Examples of thiazide diuretics: hydrochlorothiazide, chlorthalidone, indapamide, metolazone, bendraflumethiazide. Mnemonics of thiazide diuretics: hypercool IMB. 2. Loop diuretics mechanism of action. These diuretics act on the ascending loop of Henle in the kidney, inhibiting the sodium-potassium chloride transporter. This leads to a significant increase in the excretion of sodium, potassium, and water. Side effects: electrolyte imbalances, especially low potassium and magnesium, dehydration, and low blood pressure. Examples of loop diuretics: furosemide, bumetanide, torsemide, ethacrynic acid. Mnemonics of loop diuretics: the big fat elephant. 3. Potassium-sparing diuretics. Potassium-sparing diuretics either block the effects of aldosterone, a hormone that increases sodium reabsorption, in the distal nephron, or directly inhibit sodium channels, preventing the loss of potassium. Use side effects: hyperkalemia, high potassium, gynecomastia, breast tissue growth in men, particularly with spironolactone, and gastrointestinal disturbances. Examples of potassium-sparing diuretics: spironolactone, eplerenone, amiloride. Mnemonics of potassium-sparing diuretics: the C of potassium. Next class to discuss in this video is beta blockers, are a class of medications that block the effects of the hormone epinephrine, adrenaline, on the beta receptors in the heart, blood vessels, and other areas of the body. By doing so, beta blockers help to lower heart rate, reduce blood pressure, and decrease the force of heart muscle contractions. They are used to treat various cardiovascular conditions, including hypertension, heart failure, angina, arrhythmias, and after heart attacks. Types of beta blockers. There are two main categories of beta blockers based on their selectivity. 1. Cardioselective beta blockers. These primarily affect the heart by blocking beta-1 receptors. 2. Non-selective beta blockers. These block both beta-1 receptors in the heart and beta-2 receptors in the lungs and blood vessels. 3. Mixed alpha and beta blockers. These block both beta receptors and alpha receptors. Beta blockers work by 1. Decreasing heart rate, reducing the rate at which the heart beats. 2. Decreasing myocardial contractility, lowering the strength of heart contractions. 3. Reducing oxygen demand. This helps with conditions like angina, where the heart doesn't get enough oxygen. Onset oral, 1 to 2 hours fee, few minutes different. Side effects are seen like bradycardia, cold extremities, bronchoconstriction, masked, hypoglycemia, fatigue, dizziness, decreased libido, erectile dysfunction, rebound, hypertension, worsening angina with sudden discontinuation. Examples of beta blockers: 1. Cardioselective beta blockers beta-1, selective atenolol, metoprolol, bisoprolol, nebivolol, esmolol. 2. Non-selective beta blockers beta-1 and beta-2 blockers, propranolol, nadolol, timolol, sotalol. 3. Mixed alpha and beta blockers, carvedilol, labetalol. Mnemonics of beta blocker 1. V1 selective, Aunt Met BC never eats 2. V1 and V2 blockers, Please never take sweets. 3. Mixed alpha and beta blockers. Careful lambs. Next class to discuss is calcium channel blockers. It is a class of medications used to treat various cardiovascular conditions. They work by blocking calcium channels in the smooth muscle cells of the heart and blood vessels, which leads to reduced contraction and dilation of blood vessels. This helps to lower blood pressure, reduce the workload on the heart, and manage angina. Types of calcium channel blockers. 1. Dihydropyridines. 2. Non-dihydropyridines. Mechanism of calcium channel blockers. They inhibit the movement of calcium ions, Ca²+, into cells through voltage-gated L-type calcium channels. This action affects the heart and blood vessels, leading to various therapeutic outcomes. Here's an overview one. Target L-type calcium channels. Located on vascular smooth muscle in blood vessels and cardiac muscle cells in the heart. 2. Effects on blood vessels, which results in lower blood pressure used for treating hypertension. Summary of actions: block calcium entry, relaxation of smooth muscle, vasodilation, lower blood pressure, reduced calcium in heart muscle, decreased heart rate and contractility, reduced cardiac workload. Purpose of calcium channel blockers, CCBs, is to lower blood, reduce chest pain, control abnormal heart rhythms by slowing heart rate and AV node conduction. Onset of dihydropyridines typically 2 to 8 hours after oral administration, and non-dihydropyridines around 30 minutes to 2 hours. Side effects of dihydropyridines are edema, flushing, and reflex tachycardia, and of non-dihydropyridines are leading to bradycardia, AV block, and constipation. They can also worsen heart failure in some patients. Examples of calcium channel blockers, CCBs, by type 1. Dihydropyridines, amlodipine, nifedipine, felodipine, nicardipine, isradipine, nimodipine 2. Non-dihydropyridines, verapamil, diltiazem. Mnemonics of calcium channel blockers. 1. Dihydropyridines end in dipine, a nice friendly nurse is caring. 2. Non-dihydropyridines very deadly.
Like, share, and subscribe.